Welcome to Friday Friends, RI Elder Info's weekly look at the organizations and individuals providing resources for Rhode Island seniors, caregivers, and professionals.
I love the introduction music. It's so fun. You catch me sometimes, just kind of bebopping here when we go live. And today is Friday. It is also the Friday of the Newport Jazz Festival getting started. And I love jazz. Just a little fun fact about Deb as we get started here today. As you know, I'm Deb Burton, the Executive Director of RI Elder Info. And every Friday, I come on here at 9 o'clock to share with you information and resources that are going to help you or someone you know be successful at aging independently. So it's really important you hit the like button and the share button. We have a great show for you today, and we're going to talk about some very interesting research that is coming out around Alzheimer's disease and dementias. So with the prevalence of Alzheimer's disease and dementia, it's really, 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 really likely that you will know someone who will be afflicted with this. So please hit the like, hit the share, help get the word out today because people need this information. Now, because I say it every week, we are a nonprofit and we could not do what we're doing and bringing you this information if it wasn't for our donors and our sponsors. So I have to give a big thank you to Aetna. They're a wonderful insurance company located right here in the state. United Healthcare, also another insurance company here in the state. Both provide Medicare, different products with different benefits. So I encourage you to seek out the one that best meets your needs. Also, Oak Street Health, they provide primary care, comprehensive primary care at different locations across the state. They even provide transportation. And a big thank you to Tamarisk Assisted Living Facility. They're in Warwick, right over by the mall, to really take care of your family like their own family there. So if you're looking for an assisted living, I encourage you to check that out. And the magic that you are seeing would not be possible without Ben Barber. He is the Oz behind the curtain from 321 Media. And if you visited rielderinfo.com, you see the magic that is done by England Studio. They're an award-winning web design team right over in the Quonset Economic Development Park over there, and they can serve you worldwide. Again, I encourage you to check out rielderinfo.com. It really is the most comprehensive resource for seniors, for caregivers, and for the professionals who serve them. And if by some chance you don't find what you're looking for, which I guess could happen, you can always give me a call directly, and that's the 401-585-0509 number. I'm always happy to help. So today, you've hit the like button, you've hit the share button, so let's get this party started. I'd like to welcome up Terry Fogarty.
How are you this morning? Well, you seem to be in great mood. Are you going to the Jazz Festival?
I am going to the Jazz Festival. Once I go off air here, I've got one little task I need to do. That newsletter that goes out every week, I got to get that out, and then I am off to the Jazz Fest.
Well, I hope you have a wonderful time. I was at the Folk Fest last week. It was a lot of fun. It's a great event that we host here in Rhode Island. It's so impactful to our economy, for sure.
And the sound is great.
It is.
Absolutely great.
Lots of new bands, lots of excitement. Music is so important for our brain health. I know you know that, right? It's something that really engages our brain, listening to music, performing music. Musicians have very strong brains. So it's always interesting now I look at the world in a very different way, right? I'm always like, what's that doing for your brain? What's listening to the music doing? What's performing the music doing?
Yeah.
Brain health is something we really are starting to focus on, just like we did with heart health. And that's really making a difference in outcomes for the future.
Absolutely.
So I thought one of the things we could start by talking about is some of the things that we found out about what puts you at risk for developing Alzheimer's disease. Because I think a lot of people hear exercise, diet, being active in their community, but maybe we should drill down a little bit more into very specific terms. What do you
Yeah,
think
that would be
about that?
awesome. Yeah, that'd be awesome
Yeah,
because I think for a lot of folks, it's kind of like, well, I know it's not something I can do about it. Like my grandma had it or my dad had it. So, maybe I'm going to get it. Maybe I'm not. Oh, well. So there's
right.
actually things we can do that kind of prevent it.
Well, I'm going to tell you a couple things. One is some good news. The good news is that in North America and Europe, over the past 3 decades, the incident rates, so the incidence rates, that's the rate of dementia as percentage of the population, have been declining
Oh,
over
that's
the last
awesome.
3 decades by about 15%, 13 to 15% a decade, which is remarkable. So
Wow.
why? That's the question, right?
Why and
Probably
how?
want to know. So one of the big things they think has really had a major impact is the fact that smoking rates in the US and Europe have declined over the past 3 years. Hey, you and I probably remember a time when we were younger and you would go into a restaurant and you walk through a cloud of smoke.
Yes, and you'd
Or
have
there,
this section for smoking and this one right next to it not smoking.
exactly same thing on airplanes, right? This row
Yes.
was the end of the non-smoking section and that row was the start right behind you of the smoking
Yes.
section. And now we know that was absolutely ridiculous. And think
Yes.
about people who worked in environments where they were inhaling secondhand smoke
Oh,
8 hours a day, 10 hours a day, 12 hours a day. I mean,
yeah.
that really had a lot of impact on people's cardiovascular health and their brain health, we know now. So smoking and that reduction has definitely had an impact on the incident rates of Alzheimer's disease. So back in 2017, which believe it or not, was only 5 years ago. I looked at that date and was like, wow, that was so long ago. Oh, wait, 5 years ago. The influential Lancet Commission, so that's an international organization. It's a panel of doctors, epidemiologists, public health experts got together and they reviewed hundreds of high quality studies to see what if they could identify risk factors for dementia throughout the world. And they came up with 9 at the time that they felt were really, really key to having risk for developing Alzheimer's disease. The first being high blood pressure.
Okay.
So, right, that's a cardiovascular risk. It's a problem for heart disease and it's a problem for brain health. So, unmanaged high blood pressure is an issue. Well-controlled high blood pressure is not. So if you have high blood pressure, you want to make sure you keep it under control. As long as you can keep it under control, you don't have that added risk factor that it can provide. Lower education levels. Now think about that worldwide. We're one of the more educated countries. Other countries don't have this kind of educated population. So the number 2 factor they saw was a low education level.
Wow.
The more education you have, the better chance you have of fighting dementia as you age. So you want to make sure to promote education, not just in our country, but throughout the world. It creates stronger brains, and stronger brains create less dementia in the world. Now, here's one you and I know is something that we hear about a lot in the senior population: impaired hearing. That's
What?
the number. That's the number 3 on their list, impaired hearing. If you can't hear, you're confused, right? You don't know what's going on around you. You're not picking up parts of conversation or important information, and it's stressing your brain, right? If you can't hear, then you've got an additional strain on your brain trying to figure out what's going on. So if you have been prescribed hearing aids, please wear them. It could be the difference between developing dementia and not. It's certainly a risk factor.
And it's funny because we don't
hearing
think about
impairments.
that. A lot of times people get really sensitive about whether or not somebody can see if they have hearing aids, but there's hearing aids now that are like so tiny, or they'll go inside your ears, and it allows you to be able to connect with the world around you.
Absolutely.
Yeah, that's so important, and it's one of those easy fixes.
Yeah. And I always say too, people are like, oh, I don't like how they feel. I don't like the noise that they make. Talk to your audiologist and tell them this is not a pair of hearing aids that are working well for me, and let them try something else. Don't give up. Don't give up your hearing, and don't give up, your brain strength because you can't hear, when there are things that can be done for you.
Absolutely.
So smoking, we already talked about that. That is
Yeah.
huge. They're seeing incident rates of dementia starting to climb in China now because the smoking rate continues to increase, especially in the male population of China. So
Wow.
smoking is a big one. The other is obesity. People who have issues with obesity are higher risk for developing Alzheimer's disease. So you want to try to, find ways to manage that condition also. Depression, and we'll talk a little bit about that more in the future. If you are living with chronic stress, anxiety, depression, long-term, untreated stress, depression, anxiety, that really takes a toll on your brain health. They've actually done imaging of the brain of people who have chronic stress, anxiety, and depression, and can see the physical change in the brain itself, the shrinkage that occurs as a result of constantly having. What happens in these cases is, when you're living in this chronic situation, cortisol is always rushing up into your brain. Now, cortisol is that hormone that gives us that fight or flight response. When you're constantly pushing that up into the brain with stress, anxiety, depression, it's really damaging the brain itself. So you want to make sure that you get that under control. Make sure you talk to your health care provider and find some way to help alleviate that stress, anxiety, and depression.
Could that be part of why we saw an escalation in dementia during COVID? Because we also saw an escalation in mental health concerns, that anxiety and that depression. But we noticed an increase in dementia as well. Could that be because of the stress and anxiety?
I think that certainly could be. I also think people, because we were so isolated,
Mhm.
people were starting to realize maybe something is not right with my brain. Maybe I'm having, we slowed down, we slowed way down. And I think when we slowed down, we realized everything is maybe not all right. Maybe with
Yeah.
my brain health, maybe with my mental health, maybe with my physical health. I think
Hmm.
that was part of it. We are also wondering what the impact of this COVID virus is going to have long term on people's brain. In 20 years, are we going to have COVID dementia?
Yeah.
It's
Yeah.
something
It's a
that
great
people are
question.
certainly looking into, for sure. So we've talked a lot about the importance of exercise. So physical inactivity is another identified risk factor for Alzheimer's disease and related dementias. We want to be active. I always say, move more, keep moving. Don't sit still. Now, of course, you can't constantly be in motion, but every chance you get, you should get up and move. Even just take a little walk around your house. That's really important, but it's really great if we can get aerobic exercise in. And you may call aerobic exercise that exercise that gets your heart pumping. Your heart is pumping oxygen-rich blood throughout your body all day. 20% of that has to go feed your brain. So that's why we see, when we have problems where we're not getting that blood flow up into the brain, whether it's sleep apnea or heart disease, physical inactivity, we see increased rates of dementia in those people. So talk to your healthcare provider, find out what safe type of exercises you can do to keep that heart pumping that oxygen-rich blood up into your brain.
And that makes a lot of sense when you say the oxygen rich brain, because if you're smoking, your
Same thing.
amount of oxygen is much lower and the quantity of chemicals is much higher. So that
Absolutely.
really makes sense.
Same thing
Um,
with sleep apnea, right? If you have
mhm.
sleep apnea, you're not pumping oxygen-rich blood into your brain while you're sleeping. So that is definitely a problem. That's why if you've been prescribed a CPAP machine, use it. My father, it took him 3 different types of CPAP machines before he found one that was comfortable for him, that he could use without being grumpy the next day from using it. But it's important, right, that you keep talking, keep that conversation going until you find hearing aids or a CPAP machine or even glasses, that help your vision. We see problems with vision can also confuse the brain and create risk. So you want to just keep saying, this one's not working. Let's try something new until you can find something that works for you. Diabetes is also one of the major risk factors for Alzheimer's disease. And so controlled diabetes is not a problem, but uncontrolled diabetes definitely is. We have an awful lot of diabetics in this country, a lot throughout the world. So it is something that can be properly treated and managed. And it's really important that you make sure you keep your diabetes under control. And
so
then,
it's interesting how the at one time I think everything, like our parts of our body were segmented. So it was like, okay, our brain, all right, well, we have to worry about cardiac. Oh, we have to worry about diabetes. And it seems like the research is now showing that all of these things work together.
yes, the hearing, the vision, your sleep cycle, your weight, your activity level, and also your social connections in the world. That's the other one that they really identified. If you are not keeping yourself socially engaged and being part of your community and the larger world, you're at increased risk for developing Alzheimer's disease. We might have said this on here. One study showed that the lack of social engagement in your world is as bad for your brain health as smoking 15 cigarettes a day. 15 cigarettes a day. You would never smoke 15 cigarettes a day if you were trying to be healthy. Yet there are people who are, and some for no fault of their own, who are socially isolated and don't get out and engage in the world. So very important to try to find some way to get out there and be part of your community, part of your world. I love volunteering as a way to do that. I know you volunteer yourself at many events, and that's a great way to have that social engagement, be part of something bigger than yourself. And it's great for your mood, right? You walk away from these opportunities to help others and assist others, feeling good about yourself, which is good for your brain health too.
Yeah. And I want to say too, like when COVID first hit, that Friday the 13th of 2020, and they said everything's locking down for 2 weeks. Those 2 weeks, a lot of people were really going crazy because, oh my God, I'm so cooped up. I can't deal with this. But it's interesting because, like you said, there are many people who, through no fault of their own, that's their everyday experience. Like they can't get out of the house. They can't go to the grocery store.
That is very true.
And volunteering is awesome. I want to say maybe about 6 weeks ago, give or take, if people scroll through the videos, Jenny Mercado from the Office of Healthy Aging talked about the Friendly Visitor Program so that people can actually get paid to volunteer, which is interesting, but you can get paid to volunteer to visit people in their home. And what a great way for reducing your risk for yourself for Alzheimer's and other related dementias, but also what a great way to help somebody else reduce their risk.
Absolutely.
It's all those different pieces together.
It is. And now we can also have telephone visits with people. Yeah. We can also have video visits with people. So it's really, really important that if you can't get out of your house, maybe you can use another means to be socially engaged with somebody by phone. Check in with a friend who's stuck at home. See if you can Zoom with them or FaceTime with them, right?
Yeah.
It's really we all learned those skills during COVID, didn't we?
Exactly.
Yeah.
Zoom
So,
became a noun, a
right.
verb,
Yes,
an
it did.
adjective.
Yes, it absolutely did.
Yeah.
So anyway, 2 years ago, believe it or not, they added 3 more risk factors that we don't often talk about
Ooh, what are they?
okay, so the first one is excessive alcohol consumption.
Okay.
So that kind of makes sense, right?
Yep.
Excessive alcohol use. We know how we feel when we've had too many drinks, right? And if that's a chronic condition with you, every time you create that alcohol fog in your brain, that's really taking a toll on it. And so we really want to reduce our alcohol consumption. They used to say that men were fine having 2 drinks a day and women 1 drink a day. They're starting to rethink that. I can see why, because 1 drink leads to 2, leads to 3, leads to 4, leads to every day. And so people should try to address their excessive use of alcohol. The other one is something that I think you've talked about before, traumatic brain injury. I know you do a lot of work with veterans, Deb. And one of the things we're really starting to notice in veterans is those service members who went to war and put rocket grenade launchers onto their shoulders. Every time they fired those, there was concussive action in their brain, right?
Yep.
So that repeated concussive action was a real wake up to the military about what these weapons are doing to our service members. And we need to find ways to not put their brains at risk when they're on the battlefield like we have. Plus explosions around them, any of these other things. We know that our football players have damage to their brains. Our soccer players have damage to their brains from collisions on the field. So all of these type of repetitive injuries that can create concussions are really a risk for dementia.
And I would think
now,
just for a visual, like if your brain is inside the skull, and if you're doing anything that is kind of rocking that brain inside the bones of your skull, your brain gets bruised, your brain becomes more and more damaged. And there it is. I think people don't realize necessarily that there's different causes of dementia and different types of dementia. There's this thought that all dementia is Alzheimer's. And so they don't think about traumatic brain injuries as causing dementia, or, having that bottle of wine every day.
That's right. That's right. And think about if you have more than one risk factor on this list. The more risk factors you have, the more risk you're at, right? So maybe you drink, and maybe you've had a brain injury, and maybe you're socially isolated, and maybe you have a problem with obesity. I mean, you're ratcheting up the chances of developing dementia.
And in a scary way, there's a lot of people who fit that description.
Now, will all of those people develop dementia? No, absolutely not. But again, you're increasing your risk for developing it. We're not sure what keeps people who have many risk factors or who have the pathology of Alzheimer's disease in the brain, the amyloid plaques and the tau tangles. Not everybody will get the disease. So what's protecting them? We're still trying to figure that out.
They got the winning lottery ticket.
How can you have all these risk factors? How can you have the amyloid plaque and tau tangles and not be developing the disease? Is there a protective gene that's sitting in some people's body that's keeping them? And you're right, they've won the lottery if that's the case, right?
Yeah.
So the last thing on this list, and it's starting to get a lot of attention. As a matter of fact, an article was just put out about this, air pollution. Air pollution, they do think, is now a risk factor for Alzheimer's disease. And when I thought about this, I realized that those areas where air pollution is prevalent, if you think about them, those are areas of low socioeconomic communities, right? Yep. So now We know that, low socioeconomic status as well as low education levels are a problem. Obesity, diabetes, we find these in a lot of communities that also are dealing with air pollution. So this is something that a lot more research is going to start talking about and addressing.
And that kind of makes sense too, from what going back to that oxygenated blood. If you are in an environment where you're not getting clean air,
right,
then your body just can't process it.
If you're sitting right below an interstate and that car fumes are coming at you 24/7, that is a lot to ask your brain and your body to manage. So, yeah. So the good news is that the Lancet Commission has said that if we can eliminate these risk factors in our lives, we would eliminate 40% of the cases of dementia worldwide.
Wow.
That's their theory, that we could eliminate it just by eliminating these specific risk factors. Now, easier said than done, right? But certainly something we want to be paying attention to and doing our best to acknowledge these risk factors and to find ways to manage these risk factors. University of Minnesota here in the US just this year completed a study specifically focusing on the risk factors in the United States. And they found that of those 12 modifiable risk factors we just talked about, obesity, high blood pressure, and lack of exercise accounted for the highest percentage of risk factors in the US.
So we are not helpless.
We are not helpless. We are not. All of those things can be addressed with help, right? We can address obesity, we can address high blood pressure, and we can get our bodies moving so we get exercise. So there are things that we can do. And if we just concentrate on a few of these things at a time, again, hopefully we'll have better brain outcomes. The other thing I wanted to just mention is, and we didn't talk about this on the list, but the lack of sleep.
Yep.
So the CDC just put out a report that 1/3 of Americans are self-reporting that they're not getting a good night's sleep. 1/3. So that is an astounding number of our population. Now we know that lack of quality sleep can lead to other things like chronic depression, obesity, right?
Right.
Not wanting to be socially engaged, too tired to exercise. We also know that sleep is important for the brain. That's when it kind of cleans out all the junk from the day, whether it's filing information into your brain or it's draining the toxic amyloid plaque and tau tangle components out of your brain, right? I always call it housekeeping, dusting and vacuuming while we're sleeping. And if we're not getting into that restful sleep, that's not happening. So we really need to address the sleep issue. Again, we talked about the need. If you have a CPAP that you've been prescribed, please make sure you're using it. If you're not getting a good night's sleep, please talk to your healthcare professional about it.
It just sounds like individuals can take responsibility for preventing this disease to a large extent.
Mm-hmm. There are a lot of things we can do. And again, you can't cure some of these conditions or end them, but we can manage them successfully, which is what we want to be doing. So please, if you're having trouble with any of these risk factors, bring it to the attention of your healthcare provider so that they can help put a plan in place to lessen the risk for you, right?
Yep.
One other thing, because I know we're getting close to the end of our time, I just wanted to mention we're starting to do a lot of research around inflammation, chronic inflammation, and its relationship to Alzheimer's disease and dementia. And we know that chronic inflammation is bad for the body, but we also see that it's linked to mental health issues again, including anxiety and depression, which are risk factors for dementia. And the way we reduce chronic inflammation is by choosing a healthy diet. Do you know that people who consume foods high in omega-6 fatty acids like cheese and red meat and corn oil and palm oil, they have a higher risk of depression compared to those who eat omega-3s like fatty
Wow.
fish and walnuts and flaxseed? So we really have to pay attention to our diet and what we're putting into our body. We
That,
really, I mean, if we don't have to give these things up,
right.
we
But be
should
mindful.
be mindful, cut back on them. Like we don't, in my house now, we don't eat red meat very often at all anymore. I have a new mantra: red meat is a treat, you know, just like sweets are a treat. I'm
Yep.
working on reducing my sugar intake because we know, taking in all that sugar, taking in all these high fat foods are really not good for our body, and they're not good for our brain. So that's something else people can do. And I just want to say too, people are like, how about a brain supplement? Won't that help? We've
Oh
talked
yeah. Oh
about
my
this
God.
before.
There's like thousands advertised on TV, and I won't bash the companies, but wow, the Preva factor things are just like,
Yes.
wow.
Yes.
They
So
promise you the world.
remember these brain health supplements, you have huge marketing companies behind them that, these brain health supplements generate billions of dollars of revenue a year. And there is very little to no evidence that in any way they improve your brain health. So take that money that you would have been spending on those brain health supplements, buy better quality foods, more fresh produce, join a gym. That would be a great thing to do. Get your hearing checked, spend the money wisely. Don't spend it foolishly on a brain health supplement.
That is a really good piece of advice
Mhm.
because I was looking at the prices of those things, and you're right. You could easily join a gym for what one of those bottles go for.
That's right.
For
That's right.
30 tablets, and they want you to take a bunch. So if people want to participate in research and things like that, if they want to know more, can they reach out to you?
Yes, absolutely. We'd love to talk to people who are interested in learning more about research, what we're finding. We're getting ready to start a really exciting study at Rhode Island Hospital, and I just take a quick minute.
Yeah.
So in the fall, we're going to start a study called Exosome AD, and I don't have time or quite the knowledge to go into how exosomes work. But we believe that, or we're studying saliva to see if it might be an indicator. Changes that take place in your saliva may indicate that you are in increased risk for developing Alzheimer's disease. So along with researchers at Brown University, Dr. Jill Kreiling got a big almost $5 million NIA award to study this theory. And so Rhode Island Hospital's Alzheimer's Disease Center is going to help find participants who are willing to provide saliva and blood samples and do some cognitive testing. It's once a year you would come in for up to 5 years and just, I call it the spit study. You'll come spit in a tube. You'll have a little blood draw. You'll do a few cognitive tests, and we're going to take that information and work with the Brown University research team to see if, think about how cost effective it would be, how non-invasive it would be, right? A really cutting edge, novel way to detect Alzheimer's disease by looking at changes in saliva.
That would
So
be
if anybody's
easy.
interested, if anybody's interested in a pretty straightforward, easy to do, low, not a lot of need to come into our center up at Rhode Island Hospital, please give me a call. I'll put you on the list so that when we're ready to go, what we really need to do is fill these studies up quickly, right? We don't want to wait forever to get these enrollments.
Right.
Because the longer we wait, the less time we have to do this important research. So if this
Absolutely.
appeals to anybody listening or watching, please give me a call. We'll get you on the list for when we start. We're looking for people over the age of 65 who are not diagnosed with a memory or thinking problem and are generally healthy. to join us in this research project. So
awesome. And are people compensated for their time?
there is, in many cases, compensation for people's time. I think there will be some type of compensation for participation in the study. I don't have the details quite yet. We're still finalizing a lot of things with that, but I will definitely be able to tell people as we get ready to start this study.
That's awesome. And Carrie Lynn expressed interest in participating in research studies, but she's not at the right age. Do you have other research studies that are going on for maybe people who are younger?
So we have studies for people generally who are either 50 or 55 to about 90. For those who are younger than that, I always encourage them to join the national brain registries like NDALZ Now, which is the Alzheimer's Prevention Initiative, and the Healthy Brain Initiative, HBI. You can look these up or contact me and I can put you in touch with them. Those are for individuals over the age of 18. And they'll keep you apprised of anything that comes along, because occasionally there are national research projects you can do online or over the phone that help gather information for researchers. So yeah, thanks. That was a great question.
Yeah, that's good. And it's good to know that you can be younger and participate in these research studies to really allow researchers to track what happens over time. So that's really important. That's really good.
And we have to realize and this may have changed, but the youngest person to be diagnosed with Alzheimer's disease was 29 years of age. So this is not just a disease that affects people in their later years. It does affect people in their younger years. Many of these dementias do. So we're investigating this from all different avenues and using all different methods, really starting to collaborate and share this information so we can start finding these important answers, and we can eventually live in a world where Alzheimer's disease is not fatal, but a chronic condition like other chronic conditions that we manage successfully throughout our lifetime.
I hope so.
Yeah, we'll get there. We're making big strides. We're going to have to talk again because we haven't even gotten into all the research around women and Alzheimer's disease. Women are at such an increased risk for developing Alzheimer's disease, and we are trying to find out why, and some answers are starting to materialize. So I'd love to.
I just have to have you come back on.
That'd be great. I would love to do that. It's always good spending time with you, Deb.
I love having you on the show because you are always such a wealth of information for people out there.
Thank you.
It's awesome. Thank you. Thank you. And please come back.
Absolutely. I will enjoy an opportunity to speak with you and your audience in the future.
Awesome. Thank you so much for coming on today.
All right. Thank you.
Well, everybody, that was a lot of empowering information. You can be responsible for taking care of yourself and reducing your risk for Alzheimer's and other related dementias. What a powerful show this was today. I really hope that you hit the like button and the share button because it was a lot of great information that really needs to get out there for all of us to be able to take action on our own behalves. We are not just someone riding along in the current without a rudder. We can guide this ship. And that's really important. Speaking of guiding the ship, on August 3rd, next week, RI Elder Info has partnered with Senior Agenda Coalition to live stream the Gubernatorial Candidate Forum. All of the individuals who are running for governor will have questions presented to them that are related to all of us and our aging experience. And we're going to hear directly from the candidates on where their views are for older adults. It is going to be really important that people watch. So when you go to vote, you're really clear on where the candidates stand on issues that matter to us. If you'd like, you can join us at the East Providence High School on August 3rd, or you can watch it right here. I encourage you to share this information, share that live stream out, host watch parties, get your friends together. It's going to be really important that our next governor really understands the needs and issues of all Rhode Islanders, including those of us who are aging, who are older adults, who are caring for older adults, who one day will become older adults. So please tune in morning of August 3rd, 9:30 here, or join us at the East Providence High School. I look forward to seeing you all early next week. In the meantime, be well and be kind.
If you like this video, please follow us on social media and subscribe on YouTube. For more information, visit rielderinfo.com or call 401-585-0509. If you have any questions, email deb@rielderinfo.com.